Excellent. Well, thank you so much, Helen and Chio, for inviting me today. My name is Melanie Adrian, and I am an associate professor of law, actually, at Carleton University here in Ottawa. My research has nothing to do with what I'm going to be talking about today. I typically write about international law and human rights law. But about 10, 12 years ago now, I was thrust into the cancer, specifically breast cancer world. And that's what I'm going to be talking about today. So in my late 30s, I was diagnosed with advanced breast cancer. And as some of you know, this is a moment of confusion, devastation, surprise. And very quickly, patients are thrust into a very different world from the world that they may know. For me, as a literate, interested, curious person who wanted to be able to navigate my own treatment options, it was a time of great confusion. And I didn't understand anything or much about cancer, how it works in the body, what some of the physiological tools are that we have to understand it and look at it and understand it as patients. And I didn't understand who was responsible for helping me navigate this system, to understand what the different doctors do, what the different treatments are that they offer. And for me in particular, when I was first diagnosed, I was told that I had to have a radical mastectomy. And as a single mid-30s person, I was horrified by that prospect. And I was horrified both in terms of my bodily integrity, but also at this idea that we don't have any other options at this point, right? Why are we still removing breasts? I just couldn't understand that after decades of running for a cure. So for me, and as you know, decisions have to be made very quickly. And I ended up choosing a very different pathway that I'll tell you about in just a minute. But what I learned along the way was that this intensity, this moment of intensity that we're thrust into, we had to have better supports for patients, for their families, because if we're taking consent in the healthcare realm seriously, then what that has to mean is that patients have an understanding of what's at stake, right? How this is going to impact them in the moment, in the near future, and in the distant future as well. We know that breast cancer is a very treatable, very survivable disease. And so it's important that patients go in understanding what the spectrum of options, treatment options may be for them. So from what I saw, and certainly in my moment, I didn't get those supports. And so my family and I see my sister's here. My sister is Felicitas Adrian. She's also the chair of our board now. We rallied, and we tried to find on the internet, we tried to buy resources and time and really understanding and knowledge in those, especially those first weeks and months that we were trying to grapple with what was going on. What we realized in reflecting on that time is that we need a way for patients to be able to cobble together the different treatment options, but also treatment pathways, right? We needed a decision support tool, essentially. And so we looked widely, because something must have been developed, we thought, right? Patients need to understand which decision leads to which decision in the context of a personalized context. So in the context of fertility, in the context of oncology, in the context of radiation therapy, in the context of et cetera. So at the end of the day, we didn't find anything. So we didn't find a tool that could help us navigate this context. So we started one. That's the long and short of it. We came together and we started one. So we came together, and what I mean by together is the patients, other patients that were going through this at the same time, volunteers, supporters, family, and our doctors came together to think about how this could be done in a better way. So before I continue to talk, let me show you, it's just over a minute video. And it is a video that we made with my co-founder, Robin Beasley. And we just talk a little bit about why we needed to do this. And it's a great little tool that I will show you right now. Here we go.
Hi, I'm Robin.
Hi, I'm Melanie.
And we are the founders of BeTheChoice.org. A few years ago, when we were both diagnosed with breast cancer, we were introduced and became fast, feisty cancer friends.
We really wanted to know what all of our treatment options were, how they related to one another. We were overwhelmed by the medical terminology, and we really wanted to know how these treatments were going to affect us long term.
We realized that we weren't alone. Many women were in the same situation, looking for answers on how to make informed choices about their treatment.
Doctors sometimes work in silos, but silos don't work for cancer patients. So we gathered a group of fantastic people around us, medical experts, volunteers, nurses, and together we created what we call the decision tree.
We came up with a visual representation of the different paths that a cancer treatment can take and how they relate to one another. All of this in an easy to navigate format that includes pop-up definitions for the difficult to understand medical terms that you're going to encounter.
Together with everyone else at Be The Choice, this is our gift to you. Please pass it on.
All right. So that gives you a little bit of a history of what motivated us to come together over these last 10 years. The way that we think about decision making is unique, and it's unique, I think, in a couple of different ways. So the first thing we realized was that there are hundreds, if not thousands, of decision trees or decision mechanisms out there. But what we found was that either they were very, very technical and really were created to be used in the technical medical sphere, right, which isn't appropriate for patients, or they were infantilizing, essentially, to the patient. Right? Because I have breast cancer, it doesn't mean I've lost my capacity to understand and to reason and to read. And so many of them had pictures, right, about where you go, step 1, step 2, step 3. But that's really not useful when, one, we have a whole array of decisions to make, and those decisions each have repercussions on what we can do in the long term. So certain types of surgical procedures will have certain types of follow-up treatments, and others won't. Some of those will impact fertility. Some of those will impact long-term physical health. And of course, all of those impact long-term mental health as well. And that's something that's, I think, too often overlooked. So I'm really glad that we have a psychiatrist here as well, who I'm hoping will give their perspectives on this. So what we wanted to do was create a space where patients could go in their own time, being their own drivers of their education, knowledge, and understanding in this sphere. We wanted this to be scientifically robust. So all of our trees are double-blind peer-reviewed. So all of the content, the written content that you see, was written and then reviewed by 2 outside experts in the same subfield. So experts that are looking not just in breast, but then radiation oncologists, chemotherapists, etc., who are in that specific subfield. And so that allowed us not just to, obviously, as we know, blind peer review is important for verification purposes, but also allowed us to generalize a little bit our text, because we had scientists from not just from Canada, but also from the United States. And so that allowed us, even though there's great overlap, of course, but that allowed us to have a different perspective on what we were saying and to generalize it enough so that it would be pertinent generally. So not just across Canada, but also across the United States and elsewhere. What we do in our trees considers all of the surgical options first. So the challenge, I think, that's still out there, and I have not seen any other site do this as well as we do it. We list all of the surgical options that are available to breast cancer patients. So it's not just about mastectomy and lumpectomy, it's also about the types of skin-sparing mastectomies that are out there. And that still is a challenge, I think, for across Canada generally, but also in terms of the patient-doctor conversation. And we'll talk about that in a minute as well. What we do, besides showing and showcasing all of the options that are available to patients, we connect those options with and the effects of those options on the other treatment options down the line that may be necessary. And so having patients develop this mental picture of kind of a step-by-step process, but then also being able to connect their particular decision to the ultimate decisional pathway that may be open to them was really important. And so for us as patients, for example, the shading of the tree that you saw was really important. When you go down one road, the other roads shade out. And that was a really important piece for us as patients, so that we could understand, if I do this, I can't do this, but if I do this, I can do this. Yeah, so here are the options that are open to me at that point. And really importantly, as we know, more and more young people have breast cancer, and we need to talk about fertility more, and we need to talk about it early on in the treatment pathway. So we linked with an oncofertility specialist in Montreal who was able to help us integrate fertility comments, questions, and pieces, informational pieces, into every step of our tool, so that when especially young women are looking at this, they can see that they should be thinking about, for example, fertility before engaging in chemotherapy, right? Just to bring that up as a question for them. And of course, the last thing is that we're fully digital. So we have currently Be the Choice is being used as a digital platform in various clinical contexts in Hamilton, for example, and that is used to support the clinician's interaction with patients. So some of the patients in Hamilton are being asked to have a look at Be the Choice before they come in. They're also providing iPads in the waiting rooms, and having a look at those to see, what is it that you question? Do you understand the basic trajectories? And if you do, let's talk about your particular situation. Anecdotally, we have a study going on right now at Ottawa U on this, but anecdotally, we found in Hamilton that it saves the clinician time, because they don't have to go into the general, spiel. Here's breast cancer. Let me just situate this for you generally. Then let me take a look at what your specific profile is, and now let's take a look at what may be necessary and what the options are for you. It saves time in that general conversation that they're having with patients, or have to have with patients, to kind of give them an overview of breast cancer, and then relate that to their specific situation. So that's what makes, I think, and that's what we've been talking about in terms of be the choice, that's what makes us unique in this sphere. So before I go on, it's awfully odd for me to talk this long. In all of my classes, I do 10-minute segments with Q&As. But since we're recording this, we'll hold off on the Q&As until the end. But I will just break my speaking with a 3-minute video. And the 3-minute video is just it gives you a bit of an overview of what I've just described. And it shows you how the decision trees can work. And then we'll come back and I'll give you a little bit of an overview more generally in terms of consent and so on, what we hope this will do in the medical sphere. And then we'll go from there to questions and answers. So this is our 3-minute introduction to the decision trees. All right, here we go.
Welcome to Be the Choice, a not-for-profit organization that has created a new way of understanding treatment options for breast cancer. Our site was developed by doctors, survivors, and dedicated volunteers. It is medically accurate and is meant to complement the advice your medical team has. Our tool will show you a roadmap of the likely treatment scenarios for your type of breast cancer so that you have an idea of what may lie ahead. If you're being tested for breast cancer, start here. Here you will find general information on the tests that are done to find out if you have cancer. Once you know if you are positive, negative, or negative but high risk, follow the appropriate path. If you have breast cancer, click on positive. Before moving on, you'll need to understand more about the type of breast cancer you have. Underlined words have links to definitions if you are not certain what something means. Now we'll move on to the trees. Each tree represents a type of breast cancer and the treatment options available for that cancer. Let's assume you had a 2-centimeter lump. This would be considered a small tumor. So let's select the small tumor tree. If you hover over the end of a branch, the treatment choices for that entire branch will be displayed. Click a single node on the tree and a pop-up box will appear with the first bit of information in that choice. Click on the Read More tab in order to read more detailed information. Return to the tree by pressing the Back to Tree tab. You will see that you have 2 surgical choices for removing the tumor, a lumpectomy or mastectomy. Click on the next decision to read these options. To learn more about mastectomy, use the button at the bottom of the page to choose that option and also view the next steps that follow. You can continue in this way or move back to the tree using the side tab and check out the information on a different part of the tree. Alright, now you're up and running. You can print or bookmark pages using the tabs at the bottom of the page. You can save them by creating a basic profile, print your decisions, or clear them at any time. If you create a user profile, your decisions will be saved and can be viewed later on any device when you log in. For example, you can take your tablet directly to your doctor's office for further discussion, or share with your loved ones. On behalf of all of us at Be the Choice, we hope you find our tool informative and easy to use, and that it empowers you to make decisions that are right for you.
All right. So that's a very, very quick approach. And I would invite you to go on the site. We've actually made some developments since we made that video a few years ago. So thank you, Stephanie. Thanks so much, Stephanie, for saying that. This is amazing. Yeah, the idea here is that it would be simple to use. It wouldn't be overwhelming. We've spent the last year and a half, as we've all been online, and I mean, the good news is websites are open 24/7. So, as you know, and may appreciate, there's been a lot of people are still diagnosed, or at least find lumps at the same rate, right? So this has been an incredibly stressful time for everyone, but also for those who suspect or have been diagnosed with breast cancer, who have been waiting for surgeries and so on. So we have spent the last year and a half adding to our roster of resources online, and really just trying to improve the functionality of our tool. So what's the big picture here? So I think part of what drove me personally as professor in law and trained as an anthropologist and religious studies scholar, is that I just felt, almost dehumanized as I was going through the system. My capacities and abilities were not recognized, and obviously the primary piece was cancer and dealing with the cancer. And that is, of course, for many good reasons that way. But that doesn't mean that, as someone who's diagnosed, we lose this other piece of ourselves, and our ability to make choices. I understood very quickly that my relationship to risk was a very generous one. But that there are parts of the medical system that have a much more constrained or conservative approach to risk. So actually, the first question I now ask any doctor I'm thinking of adding to my medical team, I ask them, what is your relationship to risk? Because that really matters. If you will recommend something to me that has a 2% chance of reducing my risk of recurrence, and it's a 6-month chemotherapy with all kinds of other effects or side effects, then I may not want to do that. Now, studies have shown that there are patients who would, and that generally, this was now done a few years ago, so I'm not sure if this still holds, but if there's a 1% reduction in the recurrence, that most patients will say yes. Well, I guess I'm not most patients, right? But the point here is that not about me specifically or my medical team, but we have to understand what is best for that patient that's sitting in front of you, and how they envision their life in the immediate, in the short term, and in the long term. At the end of the day, it's patients who have to live with these decisions. And it's very important to have at least those conversations, and more nuanced conversations. So I think when we have a tool that will put us on, or put patients on an educated level, or more educated level, where the conversation can be meaningful about them and their way of understanding both health and disease, is important. That in itself, what we hope is that it changes that doctor-patient interaction, and that we come to that room, that consult room, in a way that respects all parties, but then also is more specific about that particular patient's trajectory. We also hope that this reduces the pressure on medical teams more generally. Having patients come in that have good resources, sound resources, double-blind, scientifically peer-reviewed resources, right? Not 1,000 different things they found on the internet they know for sure are true, right? That I know in my own work with students, I can only imagine, tell me if I'm wrong on this, that can take more time, right? Because we have to then have a conversation about, no, this isn't true. You found it on this website. Let's go to something that's more reputable. So we're also hoping, right, that this will have a positive effect on that as well. And really taking very seriously this idea of consent, right? I realized, about four weeks into my time with breast cancer that Some of the doctors, and some of this has changed now, 10 years on, but some of the doctors were offering me the tools that they had in their toolkit, not the tools that were available generally. And I think that's really important. So especially when you have a patient who is looking for other answers, right? And answers that are within the realm of possibility, right? So that really needs to be understood, and referring out and referring, to colleagues is vital in that, so that the patient can have a sense of, here's the spectrum, here's where I lie, here are the options that are open to me, and here's what I need to think about in terms of the repercussions of each one of these options. What we know from this, is that if patients are involved and feel that they're charting their course, their health outcomes are better, right? And we call that empowerment. We call that understanding. We call that education. But at the end, what we know is that this has real effects on the lived realities of the patients. And that's important, and that's vital. And I think we're all aiming towards that. So this is one way that we would suggest that that's possible to bring about in this way, using a tool such as this tool. All right, why don't I leave it there in terms of the introduction to what we're doing and how we're doing it. I would love to hear from you, your questions, your doubts. I haven't been able to read the chat entirely. I just saw Stephanie, so so I would invite you to please put your cameras on, ask a question. If you can't put your cameras on, please ask me through the chat. I'm happy to just read that now, because I'd love to have a conversation with you, and to also hear what you're doing in your own practice. And does this resonate? Does this not resonate? I'd love to hear your feedback.